We're live. All right. Hello, everyone. I know, right? I'm like, wow, it's 8 o'clock Central Time. Time flies. Good morning, everyone. How are you? Dr. Lebinton here. I help people live long and well because I believe the quality of life is just as important as the quantity of life. And I'm really excited. I say that a lot. I agree. To have this live with Dr. Evka. She's amazing. I'm a distant fan of hers. I love hearing her speak. She's a powerhouse, and her passion for all things health is palpable. So I'm really excited to be having this conversation with her this morning. We're talking about tips for managing food allergies and feeding challenges in our infants. Dr. Evka, thank you so much for coming. How are you doing this Saturday morning?
I am doing great. I have to tell you a couple things about you. First, you are incredibly responsible. Like, whoa. And I absolutely love that. And the amount of energy and passion that you have regarding what you do is also palpable because I'm hearing in your voice.
Thank you.
And I love how responsible you are, how much you care, how much you want to be making a difference. And like, what a joy to be on this show. Thank you.
Awesome. 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 Now, for those who are wondering, who are like, okay, fine, you guys know each other, you guys are chummy chummy, but who's Dr. Evka? Could you kindly introduce yourself? Who are you, what you do, and why you do what you do?
Okay, so I'm a doctor, obviously, right? And oh gosh, a whole bunch of things that I do. I've lived a life of difficulties, of many challenges.
Hmm.
And each time I've had a challenge, I've turned that challenge into like a way to help other people because feel like I want to be the change that I want to see in the world. And it's easiest to do that one person at a time.
Mm.
And
Mm.
so I've written multiple books. I get consults now all over the world regarding my books. And I also have another program that I just started, which is to teach other languages to physicians. I speak multiple myself because I'm a refugee. I lived in a refugee camp for a bit before I became a doctor, before I came to the United States.
Wow.
And it just the more languages you speak, the better able you are to communicate with your patients and establish that connection.
Wow. I didn't know that about you.
Yeah.
The refugee piece. You're amazing. I gotta say, I'm not saying that lightly. You're amazing. Thank you for what you do and for channeling your pain to help empower people.
Yeah,
Uh,
you kind of have to.
it's-
And I think a lot of us wind up with challenges in our lives
Mhm.
and difficulties. And what do you do with them? Do you wallow in self pity, or do you create opportunities to make life easier for other people? And when you make life easier for other people, like it makes you feel better. So now there's purpose. There's purpose in suffering. And suffering often is temporary, it's not forever. So it's just what do you do at that moment to make life a little bit easier? So anyway, so the books I've written, wrote a book about colic
Okay.
called the Colic Handbook, which I actually think is like the most evidence-based book out there about babies who just cry and cry and cry
Hmm.
and who have colic. And feels like when parents listen to them, and these are babies usually between like a couple of weeks old, 2 months old, parents listen to them crying for hours most days.
Wow. Wow.
It's really hard. It's really hard for them. And so, what's the solution? How do we make it better? So, and how do we prevent it? And it's all in this
Mm.
book. And then I have the FBI's handbook, and the FBI's handbook it came about. I like wrote it in like a month, because my co-author was in this support group and I were both in this support group for people who have food allergies, for babies who have food allergies, especially, but it could be anybody. And there had been these were non-IgE mediated food allergies, so not what you normally think of, which is like the
Mm.
rash,
You're right.
difficulty breathing.
Yeah. Hmm.
And our children were having these conditions. The diagnosis was now available. It was a known condition. As time goes on, more and more medical conditions are making their way into our knowledge base as physicians.
Mm-hmm.
But at that point, the treatment guidelines hadn't been created yet,
Okay.
which was really stressful because when you have a known condition, you have a group of parents together who are really struggling and are desperate for answers. And it's hard to find people
Okay.
to like physicians. It's like they're busy and there's only a few who know about the condition. Uh, it's easy in these support groups to spread misinformation, and misinformation can create more harm than good. And so you need, if the doctors aren't available or they only are only available in major cities and not everyone has access to them, or they only have short time
Mm.
to see you, then it's good to write books about topics because books are cheaper than copays usually. And so the FBI's handbook is all about non-IgE media food allergies.
Okay. Okay. Awesome. 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 So let's dive right into it. What are common food allergies that parents should be aware of when introducing solid food to their infants?
Very, very good question. So there's two types of food allergies. There's the IgE media ones where you tend to have those rashes, the firm, and then usually less of that difficulty breathing when you're a baby, but you can have that too. And then they're the non-IgE media ones, the ones that don't use this antibody, and they tend to show up more with like gastrointestinal symptoms. So if you look, our poop looks different than baby poop. It just normally does, right? But but there is still there, and sometimes like babies can have different colors of poop that we're not used to and they can still be considered normal. Red is not a normal color of poop. Blood is not a normal color of poop. Significant amounts of mucus, where the poop looks like it's mostly just mucus, is not normal.
Okay.
When those things are happening, you have to start thinking about like what's off, what's going on. And the most common foods that can give you those kinds of allergies are not what we normally think of when we think about those kinds of allergies that give us like the rashes.
Hmm.
So common food allergies for that give you that gastrointestinal stuff, and that includes also like babies spit up, and
Okay.
that's, but babies with food allergies vomit.
Okay.
And the difference in spit up is that spit up kind of goes like this down your mouth. Vomit is projectile. Vomit's like and it goes all the way out.
Okay.
That's less normal, especially
Oh, okay.
combining it with abnormal looking stools like I just described. And
Okay.
then the foods most likely to give you that, there's a whole list. So it's going to be common foods that you normally think of with allergies. It could be soy and milk
Mm.
products, but and then wheat and nuts. But there's also a segment of people, babies or children or anybody who has these allergies who's allergic to like anything, or it varies, and it could be any kind of food.
Mm.
Rice, which we usually think of as not being allergenic, right? It's not on our big allergy list. Rice is a common trigger for these gastrointestinal allergens.
Now you mentioned earlier the different, as far as the projectile vomiting versus the, spit
Yeah.
up or, what other ways can parents differentiate between food allergies and normal reactions to new foods? Like it tastes funny or texture. Like how would you advise
Right.
for
So
parents to know?
it's repeated episodes.
Ah, okay.
And so when babies are first trying food, one of the things I recommend often is the baby plays with the food. A lot more will probably wind up going unless the parents feeding it directly to them, and they might have some resistance. Um, a lot of the time, the food winds up, much more of the food winds up elsewhere, except in the baby's mouth being swallowed. And that's okay. They have to kind of get used to feeling the smooth, smelling the food. There's all these senses that
Mm.
get activated even before the food gets swallowed. And so you might notice like the baby putting food in their mouth and then going, I don't like that. And that's normal. Where we're talking more is repeated episodes of vomiting. And
Okay.
children who have like the there's variations, there's graduations of FPIES, food protein intercalase syndrome. The ones who have the more serious version also start to look pale. They start to
Mm.
look limp. They look like they're sick. They're not your happy, playful baby when they have these reactions. They look off.
Okay.
Um, Now, you can compare that to some babies who just have milder versions of these non-IgE mediated allergies, and they wind up with like just changes in their stool, and their stool is bloody, and there's tons of mucus in it. That's more like a proctocolitis, so not the full FPIES. And that's usually something children will outgrow. Sometimes you need to stop the food for a little bit,
Mm.
and then eventually it's outgrown, just as FPIES is.
Okay. Now, I can imagine the amount of stress, the amount of, whew, overwhelm. Like how, I mean, already being a parent is hard enough, but the challenges with this. Are there strategies you have for the parent who's watching who's like, yes, I'm also familiar with this. I know I've seen this, I'm dealing with right now. I've seen specialists for it. Are there strategies that can help parents navigate feeding challenges? What are your top three biggest tips, Doc?
Lots of really good questions. Thank you. The first one is surround yourself with a community of other people who are going through the same thing. And you can find those communities on Facebook. Sometimes you can find those communities if you're one of those centers, like, for instance,
Mm.
Sinai in New York, one of those centers. You might be able to find support right there in the waiting room with other families who are there for a similar thing.
Hmm.
Um,
Hmm.
also sometimes if you really are concerned about your baby just not feeding, there's organizations out there that are really helpful, like Feeding Matters, which can pair you with another family going through the same thing so that you're no longer feeling as alone,
Hmm.
because you want community and feeling like somebody has been there, done that, and has your back makes you feel better. So that's number one. Number two, don't doubt yourself. If you're noticing that you're feeding your baby and they're just things seem off, like they're not feeling like you'd expect. Maybe they're taking longer to feed. There's like certain, like it shouldn't take your baby an hour to
Hmm.
eat 3 ounces of something. Shouldn't be happening.
Hmm.
You shouldn't be having significant reactions to food. So if you're noticing that, like sometimes when we're under stress, we put our heads in the sand and we avoid, and we just think, oh, it's going to get better. Let's continue doing the same thing over and over again. Doing the same thing over and over again when it's not working is not maybe the best option. Children, like, you want food and feeding to be fun. And if children are not enjoying that experience, um, it they might wind up with a poor reaction to food that will last for a while. You want feeding to be fun. So
Hmm.
um, start off small when introducing a new food. Small amounts are better than big amounts. If you're going to have reactions, sometimes they're dose dependent.
Hmm.
So if you um, give a little bit of something, it's fine. If you give a large amount of something, it isn't. Um, so that's number two. And then number three is uh, ask the questions, get the information, learn, read. um, if you have time, because uh, knowledge leads to empowerment, and it's going to lead to better choices. An example of that is, like, if you were to, I don't know if you ever read this, but there were some studies called LEAP studies that said that if you feed your child peanut butter in tiny, tiny, tiny amounts when they're babies, they're less likely to develop a peanut allergy later on in life. But you have to start when they're young. And it just, tiny amounts of it exposes their immune system early on, because there are certain types of, like, a lot of children with FPIs will outgrow it. What we worry about more is some of the IgE-mediated allergies that start to give you rashes and then difficulty breathing. And peanuts can be a lifelong allergy that can be potentially life-threatening. But if you start early, if you start giving the little bits of peanuts, like tiny amounts, and I wouldn't do like the there's specific peanut packets you can get that have tiny amounts of peanuts in them. I wouldn't get like direct peanut butter, like you want to. I don't think babies are used to that as much, but that has been able to help prevent some of these later on reactions.
Interesting. Now, of course, these are medical suggestions. We do advise that you talk to your doctor to come up with a plan that's best for you. But yeah, I see the studies are showing that early exposure can help minimize the risks down the line. And I like that you said, you're so beautiful. You said to read, get information if you have time. Listen to podcasts. Maybe they come in audible versions. Listen to it too, so that way it's a little less tasking for you. You can listen while you're doing other things too, and passively get information that way. So thank you for highlighting that.
So the FI's handbook, like this is on my to-do list. I wrote it to myself. I have to stick with it. This is going to become an audiobook form.
Okay.
Yes. Going to be an update.
Yes.
So
please.
We're busy, right? And when you're taking care of your baby and you're doing a lot of other things, it can be hard. Or you just read a chapter at a time. But we need to update that thing. It was written, less than 5 years ago. But
okay. Yes, we would love the audible version. That would be awesome. And I like how you said one chapter at a time, so not a lot of pressure as you get more informed.
Yeah.
Now my next question is for the parent who's wondering, like, with all the their children have food allergies or it's challenging to feed because you're worried about this versus that. Now, how can one create a balanced diet? Because they worry about vitamin deprivation because of some of these allergies. Do you have any suggestions for parents who are concerned about this?
So breast milk is nutritionally complete. Some of the formulas are nutritionally complete. So if your baby's still on formulas or breast milk, you're probably okay. The problems become when there's much less of that breast milk and much less of the formula that's being used, and the child's eating only 5 foods. And sometimes in those cases, you have to add a multivitamin until the food repertoire goes up. And then you have to make sure that the baby's having a complete source of protein. Some parents stay away from foods that have protein in them because the thinking is that these allergies are due to a reaction to protein in these foods or certain proteins. Particular chemical structure of one of these proteins, not all the proteins, not protein, but every protein that you have is made up of these building blocks called amino acids. And these building blocks take on different forms or different Lego forms or different protein forms depending upon the food. And some of these Lego block forms, these proteins can lead to a reaction in the body. And some parents get afraid of protein altogether in foods because they're worried about when's the next reaction going to happen and which foods give it to the child. And you can't forget about making sure your child has all the essential amino acids. So there's lots of Lego blocks, little tiny forms of Lego blocks available out there. There's 9 that your body, the 9 types of amino acids, 9 types of these Lego blocks that the body cannot form on its own. They need to be available from food. If you're afraid of meat products with your child, although not every meat product is like, most meat products are going to be safe, but if you're afraid of meat products, I would consider quinoa and buckwheat. Quinoa and buckwheat are pretty healthy, and they have all the essential. They're complete proteins. They have all the
Hmm.
essential amino acids, and most children do not react to them. It's not as common as something like rice or wheat. Quinoa and buckwheat are different.
Awesome, awesome. Such a lot, a wealth of information. So to wrap it up, because time is going really quickly. I have someone who's watching who says, these are a lot of information, but I feel overwhelmed. I feel, oh, like why me? And any words of encouragement to that parent who's watching, who's in the grind with food allergies with the children, and having to be careful where they go and who they interact with and the schools and all of that. Any words of encouragement to them?
This
Before we
this
wrap
is
up?
hard. This is hard. I remember not being able to go anywhere with my daughter for a long period of time
Hmm.
because we're often when you're going on vacations, you rely on people cooking for you,
Hmm.
and we weren't sure what would be safe and what wouldn't be. Nowadays they have like Airbnbs and rooms you can stay in. So instead of hotels, or you in apartments, so that makes life a little bit easier. But it's still hard to be traveling. Um, so it does change your life. While you're dealing with these allergies, you're going to wind up with challenges. In those challenges, there's also blessings. Some of my best friends are best friends at a time I met because we were going through a similar challenge together.
Hmm.
And there's nothing that brings you closer together than both of you being in the trenches with something that's hard and something that's difficult. And so there's a sense of community that formed around me. And I think a lot of us are social creatures. So when we have that community around us, it can make a difference. It can help us to feel a little bit more control. And it can help, like, what do they nowadays recommend for people who might like stress? Like, stress can sometimes make you feel depressed. So what are the antidotes? Some of the or have an adjustment reaction. What are the antidotes? The antidotes are social interaction, exercise, not feeling alone, and having purpose.
Powerful. Thank you so much. Now, for someone who's watching, who's like, I already put the comment in the comment section for those who are wondering, link to her books on
Yeah.
Amazon. But how else can people connect with you? Maybe have you come speak to their Facebook groups on some of these topics. Where can people find you, Dr. Evka?
Thank you very much. I appreciate it. Okay. I can just give you my phone number, 908-679-9295. So text me. If I'm not going to answer if you have if I'm a seeing patient, so just text me. Info@evkamd.com, evkamd.com, info@evkamd.com. You'll reach me there too.
All right, you're not giving it all. So she put her phone. You put your phone number on here. So it's on there. Your email is there. You also have a website, Dr. Evka. You have a website, www.evka.com. And she's on
EvkaMD,
Facebook,
EvkaMD.com.
evkamd.com. She's also on Facebook, and she's on LinkedIn and Instagram at FKMD. So EVKAMD. Go find her in all the places. Okay. All right. She has a whole website too.
You'll be surprised how many people of the world at this point have my phone number. So,
Oh, I love how relatable you are. You're so cool, Dr. Efka. But thank you so much for spending your Saturday morning with us. I appreciate you big time. Thank you so much. I look forward to having you again as a guest of the show, probably in a couple of months to discuss topics around, coping with challenges like this. Because this needs important highlight, and parents need to be encouraged too. So thank you for
And
coming.
then let me have like the colic too, because that's such a big issue. Like there are marriages that break apart because of colic,
Wow.
or it speeds up marriages that make it's so stressful to have this child who's just crying and crying and crying. They're a lot of pain. So have a conversation about that too, because I read all the literature out there about it and summarized it in the book.
Okay, so that's something we could do maybe the next topic.
Yeah.
Okay. Deal?
Deal.
All right. Awesome. All right. Thank you to our guests. Those of you who watch live, those of you going to watch replay. I keep forgetting hashtag live, hashtag replay. Please share with your friends, people who maybe are going through this, send this as a way to encourage them. And if you've not subscribed to our channel, please like, subscribe. It helps the World Wide Web know that the information we're providing helps. So please like and subscribe. And as always, if you're looking for a thorough, a compassionate, and caring family physician who will have conversations to help you live long and well, I am she. Have a good one,
Yes,
everyone.
you are. You're incredibly caring and very responsible.
Thank you so much. And guys, just so you know, guys and ladies and gals, you can replay this video. You can always go back, and if some of the things you missed, you can always rewatch it. Okay. Thank you again, Dr. Evka. You rock.
You rock too.
Thank you. Bye.